Hello, everybody. Week 6. So I had an idea that I've been thinking about for a few weeks, and I thought this was the time to try it. So I hope you enjoy this week's video. I work in the healthcare industry, specifically with systems and data. My experience includes working with clinical systems in a hospital setting, product management for a healthcare software provider, and currently in clinical trials. To effectively perform my responsibilities and provide strategic insights, I must understand how data is stored, queried, configured, and transferred for systems. It is also essential to consider the user's behavior, i.e., understand user-centric design and how it reflects the choices made for a system's configuration. Configuration includes table design, business rules, user roles, security, and page layouts. To understand clinical decision support (CDS) within an electronic medical record system, I will exhibit an EMR product and samples of CDS occurring within the demonstration system. As patients, individuals may not have direct view of clinical charting in an EMR system. As clinicians, users can benefit from exposure to see the configuration and options of the CDS. In my experience, it is constructive to absorb a subject in medical informatics when I observe a demonstration of the software and understand the options to configure it. Agency rules and regulations will manifest into specifications influencing software design and associated features. As background, I will demonstrate a publicly available, open source, and free outpatient medical record system. The system is configured with clinical decision support. Let me provide you an overview of the components I will demonstrate before I actually go into the demonstration. So first, the EMR. Let me pull the screen over for you. The EMR is configured for CDS. The system I will be demonstrating is OpenEMR, and you can see the URL, openemr.org. From the Demo tab, I can access a list of credentials and links to 3 demonstration environments. The 2 sets of credentials I will use for the demo are physician and administrator. For this assignment, I will only highlight a few of the basic features relevant to CDS and applicable to the topic for this week. For the demonstration, I will reference colorectal cancer screening from the Merck Manual Professional version. The demonstration system will not be configured identically to the guidelines, but I will highlight the process and options for adjusting the EMR CDS to align with them. Finally, I will provide examples of system administration screens. These screens will help explain the evidence-based guidelines for clinical decision support and their connection with how they're submitted to regulatory agencies. For this demonstration, I'll focus on electronic clinical quality measures, ECQM. Okay, so time to get started. I will now begin the demonstration. So let me move some of these screens off so we can log into the system and get going. Okay, I'll provide you with a few scenarios. First, I'll review patient reminders, I'll log into the system as a physician and look up a patient. So I'm going to go to the Finder tab. And just as a reminder, this data is for demonstration only, and there's really a limited amount of clinical information. I'll select Phil Belford. And when I open Phil Belford, I'm presented with an active reminder to support the physician about required information collection. This active reminder requires me to acknowledge information about the patient. When considering CDS, evidence-based clinical decision support can be connected throughout the medical record. So this is including allergies and medical problems, medications, prescriptions. If you see down here, you have vitals, and even specific to an encounter and procedures. A clinical encounter is specific to an episode of care. That's where you could look up and see information about prior visits or prior procedures that occurred. I'll now open an example of information about an encounter for the patient. So you see it here. And that's really different from some of those demographic, as an example, the demographic or just the patient screens versus something that happened as a specific episode of care. I'll now log into the system as an administrator. So I'm going to log out over here, and I'm going to log in as an administrator. The purpose of reviewing, I'm going to go to the admin tab, and the purpose of reviewing the admin tab is to explain how the evidence-based guidelines are configured within the EMR to enable clinical decision support. You know, how you just saw that pop-up occur. So what I'll do is I'll go into an admin, I'm going to go to practice, and you see rules and alerts. And first, we'll go over rules. The rules are configurable. For example, as you see here, we have the colon cancer screening. If I select Edit in the Rules subsection, I can modify components to align with the published evidence-based regulations, you know, what you saw in that table. Once completed, the colon cancer screening rule is activated in the system to then assist the clinician. Let's just explore the configuration options by reviewing the subsections of these rule details. In the summary section, for example, you can see how you could, as an example, store the reference of where the information came from. Reminder intervals provide an example of the importance of time for clinical decision support. Time evaluation is essential for a rule to record a specified time of an event and to evaluate something at a specified time. So you're seeing that over here. Demographic data is also important. This is to invoke rules based on information about the patient, such as with the colon cancer screening, that is going to be based on age. Another example of demographics might be health equity and values related to social determinants of health that we've covered in previous sections. Next, let me show you that values can also be configured based on information collected collected during an encounter or a visit with a patient. Targets and actions, which you see over here, are defined using operators. These are conditions for a rule. What you see over here as an example is, you have less than or greater than, you have true and false. And when you have these ideas of intervals, these are loops to define the number of occurrences that you want an evaluation or a rule to occur. Do you want it to be once, 2, or 3 times, depending on the rule? And just as a reminder, when you're looking at these configurations, let me go back and just show you, because really what the idea is you want to take the evidence-based recommendations and you're looking to effectively recreate them to be configured inside of the EMR, so that you can have the clinical decision support, which are evidence-based, now configured in the system. So there's certainly some work to be done to take those and apply them into the system if they're not already there. The result of the configuration then is to emulate the evidence-based guidelines within the system. Let me also just discuss the alerts in the system as well. I think those are important to discuss. The system provides a few different types of alerts. Here's a list of several alerts in the system in the context of when they should occur. These are related to the medical history and patient. There's ones that could be specific to an encounter as another example. Active alerts requires acknowledgement every time a patient record is accessed in the system for a new session. A passive alert shows if an action is due, soon, due now, or overdue. It's not going to give you that pop-up. And then you also have patient reminders of how often you're going to alert the patient and be proactive to hopefully influence their own accountability for their care. The final component of the demonstration that I thought is relevant to an earlier comment I made, which was agency rules and regulations manifest into specifications that influence the design of software. So let me show you kind of how that would look. So in my research, I found where the system options are for clinical decision support. So I'm just going to go into this configuration area over here. And on the left-hand side of the navigation of the page is a subsection called CDR. Within the CDR options, you can see how the system can be configured to align with regulatory requirements, such as the CQM, which stands for clinical quality measures. So I want to leave you with one final moment of clarity for me provided in this lesson. Until I completed this assignment and developed the demonstration, I assumed that CDS rules were always invoked external to the EMR. I wasn't actually aware that they were configured within the EMR. And I now understand how evidence-based rules are created within the EMR. And as I was preparing for this research, what was interesting, and I was just doing some fact-finding for myself, and I think this illustrates this point. I was aware of this data tool called Definitive Health. Let me bring it up for you right now. Definitive Health compiles information about healthcare organizations, including clinical data such as hospital-acquired infections and technology adoption. And I found it very interesting that listed in their healthcare insights was a listing of the top 10 clinical decision support systems. So in my mind, I was thinking they were separate systems. And based on my demonstration, it was not unsurprising that the EMR vendors dominated most of the market share. You have Epic and Change and Meditech and CPSI, that they're the dominant players for the clinical decision support systems. So I hope this demonstration helped provide a visual example of how CDSs are configured within the workflow of an EMR. I tried to be relatively brief about the demonstration, and it was really just to give some ideas that you can visualize in your mind, or hopefully people take away some value of. And also that how those are connected to the regulatory reporting agencies. And I'll make sure that if anybody's interested in trying this, I'll add the links inside of the post for this week. So thank you very much, and I hope you enjoy this.